there are several types of nerve syndromes and thoracic outlet syndromes that can manifest with the brachial plexus, anywhere from nerve roots where they exit out of the spinal cord all the way down under the clavicle and down into the arm. But in general, the most common sites of compression are in the interscalene space or the scalene triangle, and the costoclavicular space and the subcoracoid space. There can be vascular compressions, there can be neurogenic compressions where the nerves themselves are compressed or impinged. And so there are several ways that you can address this before jumping to surgery. And that can include putting patches around the nerve root or doing a hydrodissection release, where we basically open up space in the fascia around the nerves, either in the brachial plexus fascia itself or in the surrounding interfascial layers, especially through the scalenes. And I prefer to do this with regenerative agents, both because it helps promote nerve repair and nerve remyelination, and also because it doesn't have the atrophy that other types of injectates do. For example, doing this with steroid injections can weaken and atrophy the muscles over time and really destabilize the spine. We also see some cases where people have done Botox and they've atrophied their muscles as well. And over time, that can create imbalances in the spine itself. It's sort of like cutting the cables on a suspension bridge, where the bridge itself starts to collapse to one side or the other, or to get kyphotic imbalances and all sorts of other problems. And you can also do surgical interventions, whether it's vascular or neurogenic, in some cases removing a rib so that there's more space, so it's not pushing up into the vessels and the cord, or the cords of the brachial plexus. And so the problem with that is, for example, I had one lady where they had done that, and then a few years later she had an entire anterolisthesis of the T1 vertebrae because there was no more rib to stabilize things there. And so again, it can destabilize the spine. And so this approach is a much more minimally invasive approach and a much more regenerative approach for long-term benefit. And this is what I routinely do. I specialize in complex minimally invasive image-guided procedures for ideal placement of these regenerative agents for an optimized recovery.